And thank all of you out there. I see we have a pretty good crowd, judging from the faces out there. There are some of you I know. And I just want to make sure that you can all hear me. So please just wave your hand if you can hear me. Okay, just kidding. Don't worry, I can't actually see you. Go back to what you're doing, staring at your phone, eating breakfast at your desk. Relax and just enjoy. However, well, I can't see you. I could see the list of people who signed up for today's webinar, and I see that we have a few different groups out there. We have those of you in public health, some in clinical practice, and members of the general public. What I can't tell is how many out there fall into these classifications. Optimists versus pessimists, those who see the glass half full versus those who see it as half empty, the realists versus idealists. Similarly, there are those out there who see the spring as a time for renewal, romance, and the return of Game of Thrones. There are also those who, for springtime, thoughts turn to terrible allergies, taxes, and ticks. Ticks, the subjects of today's talk. But not these heroic and cute ticks, but these other guys here. Ugly. Faces that not even a mother could love. Seriously, they are abandoned as eggs, never to be seen by their mothers again. And it's not just their looks. In this part of the country, we are all aware of Lyme disease. However, ticks are associated with many other diseases. Some seen in New Jersey now, others not yet, but may be coming. Looking at this list go by, it almost reminds me of the plagues upon Egypt. Ticks are currently considered to be second only to mosquitoes as vectors of human infectious diseases in the world. Each tick species has preferred environmental conditions and biotopes that determine the geographic distribution of the ticks, and consequently, the risk areas for tick-borne diseases. People commonly ask me on the street, parties, weddings, bar mitzvahs, all sorts of places, why are we hearing about all these diseases now? Seems like every day there's a new one to be concerned about. Ebola, SARS, West Nile, Zika, killer flu, superbugs. Why is this all happening now? To them, I like to show this little graphic here. And what you're seeing here is you're just seeing each one of these little spots of light is just one airplane taken off across the world at any given time over the course of the day. And what we can see is that we are now much more interconnected than we ever were before, and we can literally get around the world in less than a day, and so can those things that hop the ride with us. Now, when we talk about ticks, we realize that they're not just traveling with us, with the people, as we go from place to place. In fact, more commonly, they're traveling other ways. They hitchhike on birds, and very commonly with cattle, and they move with these animals as they traverse the world as well. And the world is becoming more hospitable to ticks. As the climate warms, it may not be good for humans, but it is good for ticks. And one of the things that we're seeing is that ticks are expanding northward further than they used to and to higher elevations than they did in the past. So let's talk a bit about ticks. Ticks are ectoparasites. This means that they live on the outside of you. They don't go on the inside, but they are parasites. They feed off of you. And they're parasites of all vertebrata except for fishes. There are three families of ticks out there, the hard ticks, the soft ticks, and a single South African species as well. Obviously, in New Jersey, we're worried about the hard and soft ticks, of which there are about somewhere between 12 to 15 species in New Jersey, 3 of which we know cause disease. Ticks all go through a similar life cycle. They all progress from larvae to nymphs to adults, but the exact lifestyle, particularly between the hard and soft ticks, may vary. Every step along the way requires a blood meal. There are some ticks out there that stay with a single host throughout, but most drop off between life stages, and in fact, the so-called 3-host life cycle tick is most common in New Jersey and the one that is most prone to disease transmission. And we'll talk about that in just a second. In order for ticks to infect you, they have to first be infected themselves. they can become infected either transovariously, meaning at birth through their mothers, or from ingesting an infected blood meal, namely from you or another animal. So this is a life cycle of a 3-host tick, the most common hard tick out there, and the ones that we see most commonly in New Jersey we most commonly are concerned about. And basically what happens through this life cycle is this. In the first year, the female goes ahead and lays eggs. This is off the host. Larvae, very tiny things, emerge from the eggs, and they tend to feed over that summer of that first year on small mammals, very commonly mice. That first winter, they're dormant. Then the next spring, excuse me, they pop out and they begin to look for their next blood meal. And they're looking for things like dogs, humans, rabbits, turkeys, etc. They get that blood meal, they leave the host, and they molt into adults in the summer or fall. And in the fall of the year, again, they're looking for another blood meal, typically bigger animals, things like deer, humans, dogs again. And the process starts all over again, where the adults overwinter, and in the following spring, they go ahead and they lay their eggs. In New Jersey in particular, there are 3 ticks of concern historically: Ixodes scapularis, Amblyomma americanum, Dermacenta variabilis, otherwise known as the deer tick, the Lone Star tick, and the American dog tick, pictured here as well. But there has recently been a new tick on the block, the longhorn tick, or Haemaphysalis longicornis, a tick that you may have heard about. This is a tick that was first identified back in November of 2017, about 18 months ago. It had never been seen anywhere in the United States before, or never persisted anywhere in the United States before. And we were hoping at that time that it wouldn't successfully overwinter, that it might not make it through our relatively harsh winters and be found the following spring. But unfortunately, we now know that it can survive New Jersey winters as well. It's not clear exactly how long the tick has been in New Jersey or when it arrived, but when we began to look both here in New Jersey, we found it in other places. We now know that it is in at least 7 counties in New Jersey and at least 10 states overall in the United States. We're still trying to figure out what human health impact, if any, this tick will have. So far, any testing that we've done looking for human pathogens has been negative. We do know that this tick has been associated with a variety of diseases in other parts of the world. We need to keep watching, because in order for a tick to transmit disease, it essentially has to have 2 things. It has to be potential, it has to have the potential itself, meaning the tick itself has to be able to transmit a disease, and it has to have been exposed to that disease so it has it in the system and it can then transmit. We do not yet know if as this tick survives longer and longer in New Jersey, whether it may become infected with some of our diseases here and may be able to transmit them, or if some of these other infections which have been seen in Southeast Asia may find its way here and may become endemic in these ticks in New Jersey in the future. What we do know is that there are a bunch of other ticks associated with this part of the world. This is a table showing the nationally notifiable tick-borne diseases, and what you can see is pretty much all of them include New Jersey in their distribution. In fact, all of them include New Jersey in their distribution. And in fact, if we look at tick-borne disease cases reported across the country for the last several years, New Jersey is in the top 20% of the country when it comes to that. I guess something to be proud of. In New Jersey, we've seen tick-borne diseases increase over time. There is variation from year to year. That variation can be for a variety of reasons. The number of ticks in any given year does vary depending upon environmental and other conditions. The numbers of ticks that are infected may well vary from year to year as well. And diagnosis and or reporting of the disease may vary from year to year as well. Again, in New Jersey, The ticks that we're following most closely or that have been shown to cause disease are Ixodes scapularis, the black-legged or deer tick, Amblyomma americanum, the Lone Star tick, and Dermatocentra variabilis, the American dog tick. And pictured here is Ixodes scapularis. And these are some of the diseases that have been associated with these ticks. So, Ixodes scapularis, the deer tick. Again, in New Jersey, it's been associated with Lyme disease very clearly and most commonly. This is what we hear most about it. There is a new disease on the block known as Borrelia miyamotoi. This is a disease that is not more closely related to relapsing fever, and I'll talk about this in a minute down the road, as opposed to Lyme disease, but this is associated with this tick as well as babesiosis, anaplasmosis, and Powassan diseases. This chart here is showing babesiosis, anaplasmosa, and Powassan diseases on it. Babesiosis in red, anaplasmosis in blue. You can see those both increasing over time. Powassan is that little green numbers there on the bottom. We don't get very many of them. Overall, in the country, we see roughly 10 per year. In New Jersey, we typically average about 1 or so per year is what we're more commonly seeing. I'll show Lyme disease on the next slide because it's a totally different scale as to the number of cases that we're seeing. I mean, rather than here where we're seeing in the, up to 297 of these cases, in Lyme disease in any given year, we're seeing in the thousands. And again, we've been seeing a gradual increase in most years going forward. Inside of New Jersey itself, you can see the distribution of these three most common diseases: anaplasmosis, babesiosis, and Lyme disease associated with the deer tick. And the darker colors obviously are worse, and we are seeing much more of this in the northwestern part, the more rural part of the state, than in the southern part of the state. And this is also the area where we tend to see a whole lot more of Ixodes scapularis tick. Talking a little bit specifically about these different diseases out there, human granulocytic anaplasmosis, sometimes just called anaplasmosis, is caused by a bacteria that lives, again, in this part of the world, in the Ixodes scapularis, and other parts of the world, also a different tick-related tick, Ixodes specificus. And basically, after incubation period of 5 to 14 days, it can cause a wide spectrum of disease, meaning people commonly have no symptoms at all, but it can become more severe than that. Luckily, it is not something that will typically cause you. Not typically kill you would be the better word than cause there. The symptoms that it causes are nonspecific. Things like fever, chills, malaise, headaches, myalgias, nausea, abdominal pain, cough, maybe confusion, very rarely rash. Not one of those things would make you think for sure, okay, this is what's going on. If you go to your doctor and you just do routine laboratory tests, they might see some mild abnormalities in that. Things like the white blood count might be a little bit down, your platelets might be down, you might see some mild elevations in some typical blood chemistries, but not much, nothing there that is specific. If they go ahead and they do a lumbar puncture, because you happen to be one of the few people with confusion, it will typically be normal. To make the test, to make the diagnosis, you have to do one of these tests. Preliminary chain reaction, or PCR, is a test that can be done. The problem with it is not a standardized test. It's also one of those things where if it comes back negative, you can't be sure that the person still doesn't have it. You can look to antibodies for the test as well. And in fact, a gold standard is doing what's known as paired samples, looking for an indirect fluorescent antibody at least about 2 to 4 weeks apart to see if there's been a rise in antibodies. The way that it is probably most commonly diagnosed in the short term is by looking under the microscope and seeing if you can see those little intracytoplasmic inclusion, the moruli, sitting in the white blood cell there. And that's seen in about 20 to 80% of patients. Very nice when you see it, the problem is when your doctor's looking at the slide or the pathologist is looking at this slide, most of the time you don't have that big arrow pointing right at those inclusions, and you may not see them. How do we treat it? Well, one of the things that we're going to kind of come back to, which is kind of nice, is that for most of these tick-borne bacterial infections, even if I'm not sure what's going on, if I go ahead and use doxycycline, I will probably get it right. And that is the single most common agent that will be used. And similarly, for anaplasmosis, doxycycline works well. Other antibiotics, such as chloramphenicol, rifampin, and maybe levofloxacin would work as well. Babesiosis, caused by a microscopic parasite known as Babesia microti, is sometimes called tick-borne malaria because in many ways it more closely resembles malaria than it does most other tick-borne diseases. After an incubation period of 1 to 3 weeks or up to 9 weeks, it causes a wide variety of symptoms, and again, maybe from totally asymptomatic, no symptoms at all, to can occasionally kill people. Those with mild to moderate disease tend to be the well patients, the immunocompetent patients, patients who don't have a lot of parasitemia, meaning that less than 4% or so of their red blood cells are infected. These people, you typically see a gradual onset of fever, fatigue, general malaise. You may get chills, sweats, headaches, again, muscle pains, maybe some joint pains, nausea, sore throat, dry cough. Neck stiffness, emotional lability may happen as well. Things such as abdominal pain, vomiting, diarrhea, dark urine. I'm not going to read everything. You can see it on this slide as well. But the thing that you will notice is there's nothing here that's specific again. There's nothing in these symptoms that would make somebody think, aha, it's babesiosis. Those who develop more severe disease tend to be older or immunocompromised, and they tend to have higher levels of parasitemia, and the symptoms start at least similar to mild to moderate, although diarrhea, nausea, and vomiting may occur more commonly. On those routine blood tests, you might pick up suggestions that something's going on. There might be an anemia, what's known as a hemolytic anemia, where the red blood cells are being burst apart by these parasites. You may see a decrease in platelet counts, and you may see elevation in your liver enzymes. But again, not one of those is specific or sensitive for this organism. Epidemiologically, this is a disease that happens most commonly in the summer months. About 75% of all cases we see between June and August. If you know you had a tick bite, if you got tested for something, let's say Lyme disease, which is more commonly tested for, don't forget about the possibility that those ticks are often infected with more than one organism, and you might be infected with more than one organism, meaning if you had Lyme disease and things aren't getting better, think about things like babesiosis as well. And again, some of those symptoms that we talked about. As far as testing for it, we look for it under the microscope. This is what one such sample would look for. Basically, you're looking for those parasites within the red blood cells. It is a test that is both commonly done and somewhat difficult, meaning you do need expertise and they can be missed. You can do that preliminary chain reaction, which is helpful as well. And again, you can look for antibodies. This is done less commonly as well. How do I go ahead and I treat it? Well, I use antibiotics. Here, it's a little bit different. Actually, treatments are more similar to malaria than most of the other tick-borne diseases. I use things like azithromycin and, again, I'm not going to go through the list, but common malarial type medications. Complications do occur, particularly in those who are hospitalized. They can cause things like severe lung issues as well as blood problems where clotting doesn't occur. They can sometimes cause things like the spleen itself to rupture. And if you go ahead and you get hospitalized, and again, this isn't most people, but if you're in one of those groups more prone to severe disease, who unfortunately develops a more severe disease, it can sometimes end up being fatal. So let's talk a little bit about Lyme disease. And when I talk here about Lyme disease, I'm going to be sticking to the generally accepted definitions and testing for Lyme disease. Lyme disease is most commonly caused by a bacteria called Borrelia burgdorferi. That's the bacteria that we see in New Jersey, rarely in some parts of the upper Midwest, as well in other parts of Europe and Asia. There are related bacteria that cause this as well, but in New Jersey we're talking about Borrelia burgdorferi. There are about 10 to 15 genetically distinct strains of Borrelia burgdorferi, and the bad news about that means is that there's little course immunity, meaning that you can be infected and come down with Lyme disease, go ahead and be cured, and become reinfected at some point again in the future. Again, in this part of the world, the tick that carries this bacteria is Ixodes scapularis. There are other Ixodes ticks in other parts of North America and the rest of the world that carry this as well. We see this again. This is a disease predominantly of the summer months when those ticks are out. June, July, August, as you can see in this chart here, are by far the most common months where people get infected. And after incubation of between 3 to 30 days, typically about 3 to 10 days, symptoms may develop. Those symptoms are broken down into different groups depending upon where in the disease process the patient is. Early localized is when we see that rash, the so-called erythema migrans rash. And in a second, I'm going to show you some examples, the bullseye rash. Patients may or may not feel sick, meaning they may or may not have some of those flu-like symptoms, fever, chills, those sorts of things. Again, nothing specific in those symptoms at all. Subsequently, the disease may disseminate in what's known as early disseminated Lyme, where multiple rashes may develop across the body. Neurological findings may develop. Cardiac findings, such as cardiac blocks, may develop as well. Occasionally, the eyes may be affected as well with conjunctivitis. Late disease includes things like arthritis, as well as some neurological changes as well. And here are just some pictures, which hopefully you can see on your screen there. On the top left, you see the early localized, you see the erythema migrans, otherwise known as the bullseye's rash. That is the very classic rash. This develops in the area where the tick bites. Now, one of the things I always tell people will commonly come in, they'll have a tick bite, they'll know they have a tick bite, they'll have a little bump there, a little redness around it, and they'll say, well, could this be the rash of Lyme disease? And here are some very basics that we use to help distinguish. First off, anytime anybody bites you, dog, son, daughter, mosquito, tick, it's going to leave some irritation behind. Normally, after a tick bite, you're going to see a little red bump there where the tick comes out. And that's going to be right when the tick was in or right after it comes out. That is not Lyme disease. You wouldn't see this rash for the earliest 3 days after the bite, and typically not until a week to 10 days afterwards. That's just the normal irritation from the bite itself. In addition, anything less than the size of about a quarter or so is not likely to be this erythema migrans rash. So basically, if it happens very early, it's a small bump, it's less than the size of the quarter, and then it fades and goes away, we're not talking about the rash of Lyme disease. When we talked about some of the neurological problems in early disseminated disease, what we're talking about is Bell's palsy. And that's a picture of it down there on the bottom left. And basically, people who get this, they often think that they've had a stroke. It looks very similar, although somewhat different to how a stroke would look, with a drooping eye and a mouth that kind of drags down. That is treatable. And here you see the picture of the arthritis. Arthritis means literally a swollen joint. So that left knee there is swollen with fluid. If you stick a needle into it, you can drain it out and you can see signs of an infection there as well. So how do we make the diagnosis of Lyme disease? Well, early on, if you have the rash, it's easy, particularly if it looks like that rash in that last picture. No other testing is needed to be done in this part of the country. You got the rash, you have the diagnosis of Lyme disease. In fact, as a clinician, I probably should not be doing any testing at that point, because at that point, it may yet be too early for a Lyme disease test, which is looking at antibodies, to be positive. So if I do that test, it might be negative, it might be positive, it doesn't help me, because either way, I'm thinking it's Lyme disease. Later on, if I got things like Bell's palsy, which can be caused by things other than Lyme disease, or that big swollen knee where, again, things other than Lyme disease can cause it, then I want to go ahead and I want to do those antibodies, that's serology. And the reason for that is because by that time, there'll be enough time for antibodies to develop. Those signs and symptoms can be caused by things other than Lyme disease. So the Lyme test will tell me a whole lot more. It'll tell me for sure that the Lyme test is related to the symptoms, but I'd expect it to be positive at that point in time. So what is Lyme serology? Lyme serology is a test that's looking at antibodies, most commonly doing what's known as an ELISA test, followed by a Western blot. So it's two separate tests. And the reason why we do two separate tests is because the first test is very sensitive, meaning it will very likely pick up antibodies, unless it's too early, to Lyme disease. The problem with it is that it will also give a lot of false positives. So if that first test is positive, then we go ahead and we do a separate second test, what's known as a Western blot. The Western blot is more specific, meaning it looks for antibodies to individual components of that bacteria, to the Borrelia burgdorferi. It looks for both IgM and IgG testing, IgM for more acute infection, IgG for more chronic testing. So the first test, that ELISA test, is kind of a better screening test. It'll likely pick up anybody who's developed antibodies at all. And the second test is more specific to look at whether this is really coming from the Borrelia burgdorferi organism. Not perfect tests, but they are the best we have. And the important thing to remember is just because one or both of these tests turn out positive, it doesn't mean that the patient actually has Lyme disease. You do still get false positive antibody testing, and just as importantly, or maybe even more importantly, is these antibodies may stay positive for years. Meaning if you had Lyme disease 2 years ago and you come back to see me now and you say, okay, I want to be tested because I think I got my Lyme disease back again, unfortunately my answer is going to be, sorry, I can't test you because I'm just looking for antibodies, the body's response to the bacteria, not the bacteria itself. And those antibodies can and do stay positive for years, and a positive test now won't tell me anything besides the fact that at some point you were probably exposed. How do I go ahead and treat it? Well, again, as with most of these, the most common thing that I'm going to go ahead and use is doxycycline, an antibiotic. For those who can't, other antibiotics can be used as well. For early disseminated or late disease, commonly IV antibiotics are used in addition to oral ones or instead of oral ones. There is a newer bacteria that we are just beginning to see. We've seen just a few cases in New Jersey at this point, called Borrelia miyamotoi. Even though it shares the same beginning as Borrelia burgdorferi, this bacteria is actually more closely related to the bacteria that causes tick-borne relapsing fever than it is to Lyme disease. The symptoms of cause are things like fever, chills, headache, body, joint pain, and fatigue. Again, nothing there that's specific. I want to go ahead and make that diagnosis. I need to do the preliminary chain reaction. And again, I go ahead and I treat it with doxycycline most commonly. Amoxicillin and ceftriaxone can be used as well. And again, this is still a very rare infection in New Jersey. So let's move on to our next tick here. The Lone Star tick. The Lone Star tick causes a number of diseases. You see here, the chart is of ehrlichiosis, which is the most common Lone Star tick associated disease that we see in New Jersey. It also causes tularemia, which is seen in New Jersey as well in lower numbers, as well as things like Heartland virus, spotted fever group rickettsiosis, and Stari, which is a southern infection that's not seen in New Jersey at this point. The tick is also covering up the last point on this, which is that, interestingly enough, bites from this tick has also been associated with something that's not an infectious disease, something that we really don't understand very well, and luckily only affects a minority of people, but it can sometimes cause red meat allergy, where people have been bitten by this tick. All of a sudden they go out and they have their normal things that they ate for years in the past, things like hamburgers or whatever, and they show signs of a significant allergic reaction. And I guess it can almost be nature's way of trying to tell people to become vegetarian. So talking about a couple of these diseases, human monocytic ehrlichiosis, again, is seen in New Jersey. This is a map showing where the highest prevalence rates are. And unlike those previous maps where we were showing of the deer tick or Ixodes scapularis associated diseases, diseases associated with the Lone Star tick are more prevalent down south in New Jersey. And so we're seeing this more in the southern part of the state, because we're also seeing the tick more in the southern part of the state as well. This is similar in a lot of ways to anaplasmosis, which we talked about before. The bacteria is different, the tick is different, but after an incubation period of up to 2 weeks, a wide spectrum of disease from essentially no symptoms to subacute or chronic infection can occur. And luckily, again, this is not one of the very bad infections in the world where it doesn't commonly kill people even if missed. Again, the symptoms are very nonspecific: fever, chills, myalgia, headaches, etc. Laboratory findings, you've seen these before, and again, they're not specific. Things like white counts being a little bit low, platelets might be low, liver enzymes might be a little bit elevated, sodium may be low, and red blood counts may be a little bit low as well. How do we make the diagnosis? Well, you can do that preliminary chain reaction, that PCR. The problem with it is it's not a standardized test, and kind of like some of the other things we've been talking about, a negative does not absolutely rule it out. We can and do antibody testing for this, what's known as serology, looking for the body's response. The problem with that is you get both false positives and false negatives, and to do the best test that you can out there, basically what you want to do is you want to send 2 samples separated by 2 to 4 weeks early in the course of infection, because basically you're looking to see that antibodies are rising over that time, and if antibodies are rising significantly over that time, then that's a very strong indicator that infection has occurred. And again, you can look for it under the similar to anaplasmosis, you can look for it under the microscope. Hope you can see those intracytoplasmic inclusions when they don't have that big arrow pointing to it. And you may see that again in the cytoplasm of mononuclear cells in about 1 to 20% of the cells. How do we treat it? Again, we treat it pretty much the same way as we treat anaplasmosis, which is doxycycline most commonly. Other antibiotics can be used as well. That brings us to the dog tick. This guy here causes diseases such as the spotted fever group rickettsiosis, or SFGR, of which Rocky Mountain spotted fever is the single most well-known disease in that group. So you'll sometimes hear them used interchangeably, not quite interchangeable, but that's what we're looking for here, as well as it can also cause tularemia. Once again, we're seeing this mostly down in the southern part of the state, although my home county of Hunterdon is also dark green there as well. So once again, these are a group of closely related diseases, of which Rocky Mountain spotted fever is the most serious, and they're caused by these bacteria known as rickettsia, which are gram-negative obligate intracellular bacterium. And basically what you're seeing in this picture here are those bacteria inside of the cells. After an incubation period of 2 days to 14 days or so, people get sick. And here's somewhat different thing about it is these, particularly Rocky Mountain spotted fever, is a very serious infection. And this is something that you don't want to miss the diagnosis of, because it can kill people. If treated early, it is treatable. If not picked up, it can be fatal. So what types of symptoms does it have? Well, things like fever, headache, nausea, vomiting, general malaise, muscle aches, joint pains. Again, nonspecific. These are the same types of symptoms you're seeing with every other disease that I've been talking about. What is different to this is you may very well go ahead and develop a rash, which I'll show you in a second. These are peripheral macules, meaning these are small unraised red spots on the outer parts of the body. And of course, the problem with this is the rash doesn't develop until after the fever, meaning 2 to 5 days after fever has taken place. Again, in my routine blood tests, may show some mild changes, such as a decreased platelet count and mildly irritated liver. Maybe the sodium might be low, but I can't count on those things. This is the rash here. Again, you're seeing these red spots, mostly further away from the center of the body. How do I make that diagnosis? Well, I do that antibody testing if I can. Once again, though, the problem with it is if I do that test too early, because what I'm looking for is I'm looking for the body's response to the infection, it may well be negative. So ideally what I do is I do that test twice, separated by a week or two, or a little bit longer, to give the body a chance to make antibodies, and I see the change over time. In addition to that, I can do that preliminary chain reaction. I can do that skin biopsy. I can do that PCR testing to see if the bacteria is there as well. How do I treat it? I go ahead and treat it with, again, doxycycline being my common antibiotic that I'm using for almost all these tick-borne infections, and I treat it aggressively. And the important thing is, what I don't do is I don't wait to get results of my testing before I go ahead and I treat. Because once again, this is one of the things that could kill somebody. Don't take any chances. Go ahead and treat, make the diagnosis later. So how do I prevent this? So I'm living in New Jersey. I'm trying not to become infected with all these different diseases, or, you know, after I hear this talk, I don't want to go anywhere. I just want to stay in my bedroom and lock the door and maybe just have to worry about my bed bugs and nothing else out there. Well, that's true, but there are things that you can do to protect yourself. And the best way to prevent getting any of these diseases is try not to get bitten by a tick in the first place. You should know where to expect ticks. Ticks live in grassy, brushy, wooded areas. They live on animals. They especially live on animals who live in my house. My dog seems to be an especially good magnet for ticks. When you go out, you should use an EPA-registered insect repellent. Things like DEET, picaridin, etc. have been shown to be effective. I'm a particular fan of DEET. I use it regularly. I use it religiously. I am wary of so-called natural repellents. Those have much less good evidence about it. Whenever possible, consider wearing clothing gear that is impregnated with permethrin. Permethrin is an insecticide that is harmless to you, which is placed onto clothes. Either you can do it yourself or you can buy clothes already impregnated with it, and it persists for quite a long period of time. You can go ahead, you can wash your clothes a number of times, and the permethrin is still there, and then anywhere that's covered by clothing, you don't have to worry about the ticks. Try to wear light colored pants so that you can see the ticks. Go ahead and tuck them into your socks. That way, if a tick is crawling up you, you're more likely to see it, and you're probably also more likely to see the kids pointing at you and laughing and saying how ridiculous you look. But it does work, and it is helpful. Do what you can to avoid contact with ticks. When you see them walking down the road, cross the road, walk on the other side. Avoid wooded and brushy areas with high grass and leaf litter. Walk in the center of trails. You know, if you're walking down the center of Route 78, you're very unlikely to come into contact with the tick. When you do come indoors, check your clothing for ticks. Tumble dry clothes on high heat for 10 minutes. That will kill any ticks that might be hidden somewhere else. Go ahead and shower and do that tick check, meaning you really do need to look. Where do you look? Well, you look everywhere, but in general what happens is ticks tend to crawl upwards until something stops them. So the places that they most commonly stop and supper is the back of your knees, up in the groin between the legs, inside the belly button, underneath the armpits, in and around the ears and up around the hair. And by the way, the same general thing with animals as well. The ticks will tend to go up until something stops them. So what's our general conclusion here? Well, we know that tick-borne diseases are in New Jersey and they are increasing. We also know that we don't know everything, meaning that cases are definitely underreported. While most of these diseases are what's known as reportable in New Jersey, where your local health department and through them the Department of Health is supposed to know about them, we're not hearing about everything. We know that particularly for those rare diseases, we really rely on clinician awareness and specialized testing. We know that travelers and ticks are on the move, that they're moving around and they're not going to stay in one place. We know that the best thing that you can do is protect yourself. Don't get bitten in the first place. Everything that we just talked about, from insect repellents to wearing the right clothing to doing tick checks, is important. And we know that we need to be doing more surveillance, that we need to be looking at humans and ticks and the diseases that they cause so we can identify new pathogens and monitor the ones that we know about. So camping may not in some ways be quite as much fun as these two kids are asking their father, what do you think is the most dangerous creature in these woods, Dad? Well, the answer that he gives, and probably the real answer, is the deer tick. So again, thank you. And if we've done everything right, and I haven't just been talking to myself for the last 40 minutes or so, hopefully we'll be able to answer any questions that you might have.
Well, you have definitely not been speaking to yourself, Dr. Lifshitz. So thank you very much. That was really informative. We do have a question from some of the viewers, and I also have a couple of questions as well. The first one is asking, how do you safely remove a tick?
So how do you safely remove a tick? The best way is to have a pair of tweezers or a similar implement. Grab it as close as you can to where it's attached to the skin and pull straight out along the same line of the body with a smooth, not sudden force, so that you can just pull that tick out of the skin. If you pull too hard or too suddenly, you can just separate the head from the rest of the tick. People used to do things like try to light a cigar or a match right next to the tick and try to get it to come out, or put things like alcohol or oil on top of the tick to try to get it to withdraw. We don't recommend that. So basically it's pull the tick out using a pair of tweezers, gently but firmly.
Great, thank you. Do you have any particular opinion on lawn treatments? And then there was a follow-up question from a second attendee. I guess it's the same, lawn pre-treatments. Are they effective, or is it potentially harmful for the environment? How is there a balance there, I guess?
Well, that's our talk by somebody who knows more than I do in some ways. But here's the bottom line on lawn treatments. There is no perfect one that's out there. It's a balance between using chemicals such as insecticides, which can kill ticks that are around there, or trying to use other more so-called natural means. The problem with every single one of these, while they may decrease the number of ticks seen at any given time, it's a very temporary treatment. Ticks are going to come right back. So it's something that would have to be continually done. So the short answer, they can have some effect at decreasing the number of ticks on any given lawn. Problem is, you're not going to get rid of all ticks. The ticks are going to come back. You need to keep doing this. And as to questions as to harm to the environment or something, depending on what you're using, it's a very real concern.
Okay, thank you. And I think that is someone that we may also be able to invite another presenter who can speak to that, even in addition to what you've added. A couple of other questions. This is actually a follow-up to the tick removal. And what happens if the tick head is under the skin, or if it's left in under the skin?
So that's not an uncommon problem, even in an expert situation, that the tick head can be left behind. traditional, meaning in the past, advice would be that you'd want to do what you could to try to get the tick head out. Not so much because you're really worried about the tick still transmitting disease at that point, but because you have something that's underneath the skin that can cause local infections not related to that. And if you can get that tick out relatively easy using something like a pin, that's not a bad thing to do. But here's what I'm going to tell you. It's not likely to cause a problem at all, meaning that if you try to get the tick out yourself and you do leave the head behind and you're unable to easily get that head out, I wouldn't do anything more drastic than just putting warm soaks on it, meaning take a towel or a washcloth, put it in warm water, let it soak there for 15 or 20 minutes, see if you can get that head to kind of rise out. Eventually the body will get rid of it. In the rare instance where it should become infected or something else happen, well, then go see your doctor. But basically, do a gentle attempt to get the head out, but don't go crazy.
Great, thank you. Another question, do you foresee that New Jersey may at some point develop a robust tick surveillance program similar to what we have for mosquito tracking, considering the number of diseases that appear to be of public health concern?
This is a great question. And first off, the questioner says something that's very important. New Jersey does have a robust mosquito tracking program. New Jersey is not necessarily at the top of the country in many things, but one of the things that we do well and have been doing for roughly 100 years or so at this point is track mosquitoes and have mosquito control in New Jersey. The problem of, and that comes about from early in the last century when diseases like yellow fever, malaria, and directly related to mosquito were seen in this part of the world, and they were major public health risks, and resources were given to help prevent that, and some of that has continued to this day. The problem with things like other vector-bornes like tick is they don't have that long history, and the public health resources, basically the money, has not been provided that would allow for that sort of response. And it's not just New Jersey that has this as an issue. Throughout the country, tick surveillance is not very robust. You can see that just in the fact that the longhorn tick, when we found it in Huntington County, we thought it was never really seen before in North America, and then we looked harder in both in New Jersey and other parts of the country and found that it exists in other places as well. So to kind of answer the question, I would strongly support, and certainly before, more robust tick surveillance in New Jersey than currently exists. Whether we will get there, given, that's a political question that comes down to money and other issues. And I'll just say I'm less than cautiously optimistic that we'll get a lot more money.
Okay, thank you. The next question is actually one that I had as well. Are you seeing any resistance to doxycycline when it comes to treating tick-borne illnesses?
Short answer, no. Again, the long answer, you get into the questions related around particularly Lyme disease and the question about chronic Lyme and whether that could be related to ineffectiveness of the antibiotics, which really isn't a direction that I want to go through. But the short answer is no. And then let me kind of take it a step further. If I'm a clinician, or if I'm seeing a patient, or if I am a patient, and I'm in June, let's say, or July, and I see somebody who's developing a fever and chills, and fever meaning 102, 103, and they're shaking and that sort of stuff. And I don't think they probably have flu, which is the most common thing that would do that most of the year. But in June, I'm probably not seeing that. And I don't really see anything else with them besides the fact that they kind of look like somebody would look like if they had that fever. I mean, they got a bit of a headache and they're just kind of achy and they don't really want to get out of bed. In this part of the country, one of the first things I'm going to be thinking about is whether this might be one of those tick-borne diseases. So in this part of the country, compared to, let's say, if I was sitting in, Nevada, one of the first things that I would do, in addition to looking and testing for a whole bunch of these tick-borne diseases, is I would more aggressively and sooner treat with an antibiotic such as doxycycline while I was waiting for those tests to come back.
Okay. Thank you. Is there a possibility of a Lyme disease vaccination being available to the public?
Lyme disease vaccination. Well, for those a little bit older or younger than me, I guess, they'll know that there was a Lyme vaccine that was available to the public about 15 years ago called Lymrix. It is no longer available. And the problem with developing a Lyme disease vaccine for people comes down to a variety of issues. First, it's not very economically viable for companies to do that. It's still a relatively small population that would be interested in a Lyme disease vaccine. It takes an awful lot of money, an awful lot of expense, an awful lot of time to go ahead and develop one of those things. And then when you do develop one of those things, you have to worry about concerns about liability. One of the things that drove, or the two things that drove the old Lymrix off the market was, number one, there wasn't enough of a consumer base who was interested in the vaccine that made it commercially viable for the company. Number two, the company began getting sued by people who were claiming that the vaccine was causing symptoms that were similar to Lyme disease, which it probably was not, which led the company to say, hey, it's just not worth it. You know, I'm not making any money. I'm just going to go ahead and get sued. So to answer the question, I'm not while there is research that I'm aware of that's looking at the potential for a Lyme vaccine for humans, there is nothing that I'm aware of that is close or is likely to be out anytime very soon.
Okay, well, thank you very much, Dr. Lifshitz. That's the end of our questions. And thank you to the nearly 200 folks who were taking part in today's webinar. I just want to remind everyone that we do have another webinar coming up 1 week from today on the measles, and which will also be addressing the current outbreak. So thank you all very much for joining us, and I hope you all have a great weekend. Take care.
Thank you.
Thank you again, Dr. Lifshitz.